Good afternoon, everybody. My name is Megan Nolan, and I'm the current president of the Adelphi Society for Psychoanalysis and Psychotherapy, also known as ASPP. We'd like to welcome you and thank you for attending one of our 2022 Meet the Author events. There are two parts to today's presentation. For about an hour, we're going to listen to Dr. Kahoud and interview Dr. Billow and Dr. Slonim on their recent book, Richard M. Billow's Selected Papers on Psychoanalysis and Group Process, Changing Our Minds, after which we'll open it up for questions from all of you. Throughout the workshop, please feel free to write any questions or comments in the chat box. During the second part of our event, we'll open it up for you to share your questions. Today's event is non-HIPAA compliant and will be recorded and be posted on our ASPP YouTube channel. Our analytic community continues to get stronger and stronger with each new member. So if you're not a member of ASPP, we'd love you to consider joining us. I see that Dr. Amira Simha Alpern, the director of our postgraduate program, is here. I want to thank her for supporting our work. At this point, I'd like to introduce Dr. Dustin Kahoud. Dustin is the chair of our Meet the Author committee. He's a clinical psychologist, psychoanalyst, and author of Sex, Drugs, and Creativity, Searching for Magic in a Disenchanted World with Dr. Kanafo. He will also present a paper in one of our upcoming psychoanalytic salons, The Rise of Oedipus Tech, Life in the Shadow of the Digital Object. Dustin completed his psychoanalytic training at our Derner's postgraduate program. He's an adjunct professor and clinical supervisor at the psychology doctoral programs of Adelphi University and LIU Post. And he maintains a private practice in Great Neck, New York. So without further ado, Dustin.
Hi, everybody. Welcome. Usually we call this Meet the Author, but we're lucky enough today to have a Meet the Authors event. And we have the pleasure of speaking with two authors, Richard M. Billow and Tzachi Slonim. They are the authors of Richard M. Billow's Selected Papers on Psychoanalysis and Group Process, Changing Our Minds. Richard M. Billow, PhD, ABPP, is a clinical psychologist and holds postgraduate certificates in psychoanalysis and group psychotherapy. For many years, he directed the postgraduate program at the Derner Institute at Adelphi University. He's the author of Relational Group Psychoanalysis from Basic Assumptions to Passion, Resistance, Rebellion, and Refusal, the 3 R's, and Developing Nuclear Ideas. He's a clinical professor in the postgraduate program in psychoanalysis and psychotherapy at Adelphi University and practices in Great Neck, New York. Tzachi Slonim, PhD, ABPP, studied philosophy in the critical rationalist tradition before becoming a clinical psychologist. He studied the philosophy of education in Israel, where he also studied group analysis and participated in conflict resolution work. He maintains a private practice in New York City and is adjunct professor at the postgraduate program in group psychotherapy at Adelphi University. I thought I would start off just by the title, just a question about the title, the subtitle, Changing Our Minds. I was wondering if maybe you could speak to what that is referring to, changing our minds.
Well, first of all, I don't think our titles could be as good as yours, Dustin. Sex and whatever, sex and drugs. So I salute you. But in terms of changing our minds, you know, we're all relational. But, you know, relational means different things to different people. And for me, relational has a lot to do with the relation people have to their ideas, particularly emotional ideas. So the idea of changing our minds sort of focuses on that idea of you know, minds meeting and influencing each other. I think, Tzachi, you thought of that title, didn't you?
Uh-huh.
Yeah.
Well, just to say, we were hoping for that to be the main title, but because of, you know, the publisher wanted to change it, made it the subtitle. But what I would add is that, well, a couple of things. One, changing our minds could be very casual. Like you change your mind, you wanted a burger and then you got a pizza. But so the idea is that it can do both, that it's it can be casual, but it can also be very deep. And also that the idea of every session is that something needs to happen and minds need to change. That's the premise that goes throughout the book, that we want that in every encounter something needs to happen.
Yeah, and it doesn't have to be on the level of language. I think most of us agree that we're trying to get at experience that occurs before words. Certainly an important part of what we're doing. We're using words often to talk about experience that really can't be captured well in words.
Right. I like the use of kind of playing with different words and what their meanings are throughout the book. And just in my role as moderator, before we started, I was asking about like authenticity versus, as a moderator, am I coming at this with what you talk about in the book as authenticity or sincerity? And I was wondering if you could talk about those two those concepts and what the difference is.
Well, yeah, I mean, I could give you the long version, the short version. So let me start with a longish. If you think about Melanie Klein's work and the manic defense, you can think about sincerity as kind of an immediate translation of feeling.
Mm-hmm.
Authenticity is more complex. It really has to do with tolerating the loss of meaning and not being sure. It's much more related to I think, the depressive position, and just that level of insecurity that I think in the work you need to have. Bion was great with his epigrams, and he said, and many of you know this quote, in the consulting room there should be 2 scared people or 2 frightened people. So I think it gets to that we have to tolerate mental pain, basically,
Mm-hmm.
as part of the work, in my opinion. That's why it's so hard, because we're feeling pain all day.
Right. Yeah, and so this kind of speaks to the distinction that you are, I think, espousing in the book about the role of the analyst being more active and not as much of the leader who sits back and is more just only empathic or supportive and lets the group take over and sort of end up with the goal of them ending up being their own group and the leader sitting back, right? Using the countertransference to, bring that type of authenticity to the group.
Well, let me unpack that a little bit, and maybe Tzachi can.
Maybe can we just add something to the bit about authenticity? First of all, in common language, sincerity and authenticity often are used interchangeably. But I think one thing that spoke to me in my conversations with Rich about authenticity is this idea that authenticity also it's not just you expressing something that's inside of you. So that it's also thinking about who you want to be. So it's always not just who you are, but it's some combination of who you are and who you want to be, and the struggle to express that.
I said that? That's pretty good.
All right.
So let's unpack some ideas that Dustin talked about, and it relates to authenticity too. And it's not only about group. Gil talked about this in the 80s, the last century, about how the classical mode of the analyst is iatrogenic, because you're constantly dealing with deprivation, and needless step. What's the point of it? So I thought his arguments were very, very cogent, and I think most people now are freer with recognizing that they have a strong presence, and what they, silence probably is the most powerful presence, the most provocative. So I think it should be used carefully. Now, on the other hand, there's a movement in both group and individual analysis of a lot of attention on the here and now, and intense interactionalism. And that really has to do with some assumptions that are being questioned now in terms of what really is intersubjectivity. The French, and I think the Canadian French, as well as writers from France, they're coming up with other terms. I was just reading a paper by Scarfoni, and he used the word intersubjectal, to get away from the idea that there are others in the room besides the two of you, and those messages are very powerful. And so that you want to have interaction to the sense of allowing each subjectivity to kind of unfold, particularly the other, the patient and the others that the person brings into the setting. The originary others, is Laplanche's term. So intense interactionalism also relates to a disease of therapists and analysts. And I use, again, Bion called it dis-ease. Because we're ill at ease, we tend to rely on an overemphasis on empathy with the patient. Meltzer called it empathism. So, and you really see this, and I know I have some of the people in my training groups here, you really see it amongst a bunch of professionals, either in therapy or, as I have some training groups of therapists, mainly group therapists, and there's so much empathy that I'm constantly working at, why don't you just say how you feel and stop being so empathic? How you feel, how you think.
Right.
So that opens up a lot of possibilities of, of deconstruction. So, what's going on? And when you're not empathic, are you identifying with the patient's objects? The so-called complementary countertransference, or are you really not even dealing with the patient primarily, but with your own inner objects, your own originary figures? We don't know all this, and these are questions that we can ask ourselves. So,
Right.
and that takes time. So,
Can I bring it to the book? So there's a chapter. It was one of the last ones that we added because it was a fairly recent paper about working with therapists in group. and it addresses that exact issue. When we're, Rich was talking in that chapter, he talks about how it doesn't feel very good to criticize someone for being too empathic, but that you have to do it anyway.
Yeah, with that.
I just think that chapter gives more of a kind of a flavor of what Rich is talking about, where there's a member who gives a dream and everyone is very complimentary about the courage to bring in a dream, but it's not very clear whether anyone's doing much with the dream.
Right. Like where, and I think you get into this balance of, instead of walking on eggshells in this regard, you're trying to strike a balance between the de-emphasis on objective truths in your interpretations, and having the interpretations be co-creations between your subjectivity and the patient's subjectivity, with also, as the leader, being the center of attention, right? In the It's All About Me chapter that you get into that. Is there a balance? Is there something you can say about trying to strike that balance?
Yeah, when I use the word co-created, I usually put it in quotes, and I try to be sarcastic. I'm not a big believer in co-creation.
Okay, that might have been that's my words, I guess.
Yeah, I mean, that has to do with the analytic third, but if there's a fourth and a fifth and a sixth, that whole, that kind of Case talks about inner groupality, that we bring groups, not only inner objects, but the family complex, Freud called it, into the hour. So I don't know who's co-creating what. I might be co-creating it with a originary object in my mind.
Right.
And, I might be far from the patient's experience.
Right. So Zoom might actually.
I don't worry about that so much because the person can tell me. That's interesting.
Zoom could try to charge us more if they knew how many people are actually in the room here.
You're right.
Consider. So let's keep that secret. So, okay. Well, thank you for.
Yeah, All About Me is, again, it's a complex idea, which is, I think, ironic. Tzachi doesn't feel it's ironic, but it's definitely somewhat sarcastic. And I kind of spin it out. I don't know if we want to spend time on it now. But what it means really is, again, it gets back to the idea that you're a central focus. And if you don't say anything, you're just making yourself more focused, but you become, why not speak your mind? And that's what, what do we want from, therapy? What's the criterion of an hour? Which in my mind, it's not to cure anybody, but to struggle to say something truthful. Right. And to get out of cliche, and again, there's a lot of deconstruction in that, including your own mind. Beyond talks about memory and desire. To get out of that bind of, to allow something new to emerge.
I'm going to try to contextualize, in terms of this, because I think it's a really nice way to get at some of the specific things that we're talking about in the book. I think co-construction comes from the idea is a critique of a classical position where there's one who is the authority, the therapist, and the patient who is the who doesn't know. And it's meant as a way to create a more talk and create about a more egalitarian situation. But I think one of the things that we talk, or that Rich talks and I try to highlight in the book is a therapist that's what I think he calls a confident hypothesizer, meaning that you bring in your ideas with confidence, but they're always hypotheses. They're never they're always open to amendments.
Mhm.
But where it differs from, I think, some of the relational ideas is that it's not the therapist still is an expert in the room, and doesn't hide behind this kind of a we're all the same and we all we're all just people in the room and there's no difference.
Mm-hmm. Right.
Does that seem fair, Rich?
Well, yeah, I mean, sort of complicated. You can say, well, I like to say I'm a therapist. I never said I was a good therapist. So, I mean, it sort of relates. You could be an expert, but not a very good one. So, I mean, it's, you
But
want
the
to,
idea that you're always an expert, even if you're not, even if you're a bad one, you're
yeah,
in
exactly.
that position.
Yeah, there's no, right. You don't want to have false humility.
Mhm.
But people are afraid. They're afraid to take a chance with their ideas.
I don't know who those people are. Definitely not me.
Well, go for it, man.
Uh,
This is your moment.
yes, yes. I was wondering about in the forward what Earl Hopper was talking about in terms of the hybrid identity of a group analyst, that analysts traditionally have not that many analysts, psychoanalysts, are as interested in group, and groups are not as, there's not as many psychoanalysts running groups, and group leaders are not as often psychoanalysts. So he was talking about this hybrid identity that comes from, but he doesn't get that deep into it. Do you know what, can you speak to that, the hybrid identity?
Well, I consider it a more complete identity. I think people who are not experienced in both modalities are handicapped. And frankly, I think they're depriving their patients of a very powerful therapeutic modality. The combined treatment.
So, yeah.
A lot of analysts are afraid to do group, and a lot of relational analysts don't want to relate. I mean, group forces you to relate.
Right. That one case that you spoke about with the man who gets very angry. I'm not sure exactly which chapter that was in.
Probably every chapter someone gets angry.
Well, I was interested in how you
Often me.
handle that. Yeah, I mean, mostly either whether towards you or towards another group member, how when you're bringing this authenticity about your countertransference towards different group members and what's happening, how you deal with that, with those intense reactions that are bound to happen.
Well, nothing works as well as good clinical judgment. So, some people need to be angry. Some people need not to be angry. So it's probably not kosher anymore to say, you don't have to have a hissy fit, just say what's on your mind. But, so I'm not necessarily,
Kosher.
huh?
Kosher.
Yeah. I mean, do you know what I mean? Like, any emotion can be hyperbolic. just because it's an emotion, it doesn't mean that it's, you know, it can't be challenged. You know, people say, well, how do you know how I feel? Well, you know, it's very possible I know how you feel better than you do.
Right.
You know, you never heard of dissociation? So, I mean, you know, you don't have to be afraid of challenging feelings. Sometimes you might know better. And by the way, you don't have to be the therapist. You can be a group member where people say, you know, I think you really feel this way. And, you know, and isn't that true in your lives where you don't realize how you really feel?
Yeah.
You know, and
I like this paradox of stupidity that you talk about. Awareness of one's stupidity as the key to such wisdom that we can hope for as group leaders, that we don't want to, I guess, acknowledge feeling those types of, I mean, that it's a challenge to acknowledge feeling those types of feelings or jealousy, you know, certain things that are not usually in awareness.
well, that's, yeah, I mean, that's, you know, sort of a Bionian idea that you, not that you followed it, but, you know, you kind of say all you know so that there can be a kind of freedom in the room of two people who don't know. You know, the role of ignorance. You know who's, I read in the Times, it was Toscanini, I said, who I think said it, where he said that every time he led a symphony, he realized how stupid he was last time. So
Right.
I really like that image, you know, that you're the leader in any, you know, whether you're doing a group or a therapeutic hour, you know, you're really directing the hour. Even, you know, silence when you, and then speaking, you know, you're molding the hour, you're valuing certain communications and not others. So there's no getting around it. Even your breathing. So, you know, if you, I do a fair amount of writing, and gives me an opportunity to review what, and you know, you always can, why didn't I think of that before? Why didn't I realize that? You know, it's just like if you discuss a case with a colleague or a supervisor, or even a supervisee, you always learn things that, you know, so there's always that discovery process. And that's part of, I think, why we love the work.
Right.
So,
I think just to add a couple of things about this idea of stupidity, I think it needs to, it's important in a sense that we always think to know that we're, you know, there's no, we haven't reached the truth with a capital T, but I think it's also can be used to hide. I mean, and I think sometimes it's easier to say, I just don't know, and just ask more and more clarifying questions, as opposed to, you know, trying out an idea and really sticking to it. But so I'm a chess player, and so the world champion is Magnus Carlsen, and someone once asked him who the best player of all time is in his opinion, and he says me 4 years ago. So I thought that's nice in a way of, it was both, you know, humility and arrogance in one statement. So I think there's something about continuing to really assess what we know and what we don't know and where we're at, but not hiding just behind not knowing.
yeah, I mean, an obvious example would be, you know, patient comes in or group member and says, you know, I had a dream, I don't want to discuss it, it's stupid, you know, and it's in a way nothing stupid.
Right.
So,
The way that you make distinctions between a lot of these concepts such as diplomacy, integrity, sincerity, and authenticity, which we already talked about a bit at the beginning, but also the three kinds of deconstructive intervention, differences between bonding, cohesiveness, identification, and therapeutic alliance, and the stage model of relationships, the symbiotic, commensal, and if things go wrong, parasitic.
It's there's really not a stage model. I mean, there really isn't a stage model if you follow Kleinian Bion approach. And that, by the way, is a distinction between many writers of group and I guess individual therapy too, where they talk about stages. There's forward movement and regression, and there's also this, in an hour, you move back and forth between many different states of mind. So, I mean, that's part of the distinction between the, from Klein and Anna Freud. Where they, particularly the analyst who to be creative has to, he has to regress in the just in the service of the ego. In a Kleinian point of view, though Klein didn't take it that far herself, you want to get in touch with the psychotic part in yourself. And it exists, so you might as well get to know it because it's going to impact your work.
And that round, Rich, you want to talk about, maybe say something about Searles, because I think he's the great, he's an influence of yours, and we mention him in the book, and he really talks about that nicely.
Yeah, he certainly was a courageous person who opened up some of his own primitive thinking and feeling. He was, the best part of, I mean, I love reading Searles, but I was able to observe him many times. Matter of fact, in Boston where I interned, they used to say the circus is coming to town, and he would give these fantastic demonstration interviews with patients. But some of the ideas that are very popular now came from Searles. The idea of the patient cures the analyst. He was a great innovator. I once asked him. I met him at a cocktail party. I was with my wife, and I was sort of, all shook up. She says, talk to him. So I went over and we started talking. I said, have you ever read Bion? I said, I think you'd really like his work. He said, no, I haven't. I think he eventually did. But I was a little confused. I was early in my training. I said, this sounds so much like, Kleinian, his openness to these primitive feelings. So he certainly was an inspiration. And we need inspiration.
Yeah. I was actually thinking, one question I had about your group expertise is, or like what, if you've noticed this lately, but just in my work with individuals, I hear so much more strong dichotomies. I think, maybe I'm noticing it more because of social media or the divisiveness of our culture, our country's culture, I guess, it right now politically. But I wonder if groups, maybe more valuable than ever at this point in time in our country, just due to these intense the divisiveness that's happening right now, and people have very strong feelings because they are getting they're in their own echo chambers where they're only seeing things through the algorithms of their social media that keep emboldening their own way of thinking and not as much integrating the the other sides. So I know this is to some extent has always been an issue, but that integration, I wonder how group could really be a stronger type of antidote to the way our society is right now, the zeitgeist of just.
Well, there are different types of groups. Years ago, I took part in a conference in Israel where I ran a group with Israelis and Palestinians, and there was before the Intifada, and there was some meeting of minds for a while, but the political situation really undid a lot of that kind of work. So I mean, there's a place for it, but it's not easy to put together, people with very divergent viewpoints, even in a therapy group. It can be done. In the groups I run, there are several groups where there have been one or two people on the right and people on the left. But what happens in a group, when you get to know people as humans and feeling people, often we can jump over that or joke about the differences or learn to tolerate each other. But in terms on a societal level, it doesn't sound like we're heading in that direction. It'd be nice if we could use group for that. And I mean, there are attempts. It's really not my specialty to that level of work. There's a lot of work around microaggression, all those kinds of social groups. Matter of fact, at AGPA, you have to attend one of those group meetings for sensitivity training. It's sort of enforced. I don't know how deep it really goes.
Yeah.
If you're interested, it says something about you already, that you're open. A lot of people are not open, don't want to be. That's just my opinion.
Yeah, I was just wondering if it's more unavoidable now, just even if just in regular groups, but.
Well, you got to start your group and you'll find out.
When I think of it, that's what I think, that and it could end up being pretty dangerous sometimes, thinking about who would, some of my patients and their very different viewpoints about things.
They're really bonded to you when they're interested in the work. All that could be worked out. In group, I think that the first bond is to the leader, and then the spokes go to the members.
Right. Oh yeah, that's what I was wondering about before, is the distinction that you made between bonding and what is it that you have? I'm sorry, I just blanked out for a second.
Well,
alliance and yeah.
Yeah, I mean, there's a big difference because there are people who could be bonded and not show up. Matter of fact, they can even leave your practice, but they can be very, very bonded to you and to the work, and think about it. Even though they leave and say that was the worst experience they ever have, but they might think about some of the ideas. So.
Well, one of the ideas that the bonding chapter and I think that whole section is focuses on is that the leader in a group, one of the things a leader constantly has to think about, and it's easy to forget, it is how is the leader doing with each and every member. It's the idea here is that it actually goes, it's relevant to family situations too. When each when each of the children is bonded to the parent and has a good relationship with the parent, they're more likely to do better with each other. But when there are significant issues between the siblings, often have to do with something being not okay between the child and the parent, or one of the parents.
Yeah. Yeah, let's look at this from another point of view, that I find in supervision, and even in the way that people conceptualize. It's much easier to talk about the negative transference. I think therapists are much more comfortable. But to deal with all the vicissitudes of being loved can be very difficult. And you can't, if it really doesn't work to say, well, the patient is idealizing me. It's really, it's not true. There's the issue of gratitude and respect and mutual caring. You really can't treat somebody well if you don't care for the person. And if you do care for the person, you could say almost anything to the person. You can say, I really hate you now, or anything, almost anything, because there's a basic level of trust that comes from mutual caring.
I had an experience with what you're saying, because about Rich, about taking in the love, with a patient who's a single mom, and her son would say to her, "Mommy, you're the best mommy in the world," and she kept saying things like, "Yeah, I'm okay," or "I do fine." And one of the things we were working on is that this idea that not taking in that love or that admiration is also is hurtful to the child, because he doesn't get the experience of giving his love. And yeah, that also became it was brought up in group and became a very interesting nuclear idea. How much are people able and willing to take in love, or do they have all sorts of maneuvers to not take it in?
Yeah.
Yeah, it's much more complex than the old idea of the patient falling in love with the analyst and the that Oedipal level. Didn't Freud talk about the positive transference and how crucial that is for work to progress? He called it a cure through love.
Right.
Said other things, but it's it's important to deal with being loved, and also that then relates to the love you've received before, and whether you trust love, and what do you do with it?
So when you have siblings and a lot of positive transference in a group, does this create difficulties with competitiveness for the love of the analyst? And how does this, and like siblings fighting for the love of a parent? Is this, this is all, I guess, material. And the countertransference of the leader trying to manage that must be interesting.
I had a group, and I wrote about this, where two women were fighting. They're actually fighting over a seat. This is my seat. You came, I was in group before you. And what I came to understand, and I they weren't really fighting against each other. They were fighting for me, to be in the favored place. And there's a way to say that, where it kind of deconstructs and takes some of the energy out of the fighting. but then you have to say, it's really wonderful to find two lovely people fighting for me. That's why I do the work. You can play with it, and I think humor is a great way to to deconstruct and to to modify some pain. It's always, part of the skill in our work is how do we say painful things so that it could be, born.
Right.
What do and then it comes, why do you have to fight so hard for me? And then it relates to a lot of trauma. Why can't people get along and share? How does that have to do with the history? How does it do with suspicion of who you might like better as a therapist?
The issue of sibling rivalry is, when I think about it now, when I have a newborn and a 3-year-old, and I really see it very clear. It's not hard to see when the newborn is nursing. My 3-year-old is, he's very unhappy, and it's painful. He wants to be on mommy, and he can't, and he's been able to say, I want mommy to give the baby to daddy, and that's an accomplishment. But you can see it.
Yeah, that always, it really relates to when a new member comes into a group.
Mm-hmm.
And often a group goes silent when a new member comes. There's so many issues around that, and it partially relates to what Tzachi's saying. And often the anger is redirected towards the leader, as I'm sure you must have been smacked around somewhat as a parent by your 3-year-old.
You're saying it in past tense?
I like the talk, not to say too much. I don't know if anybody knows, but I'm actually a therapist myself. And so I really like the chapter. I liked when you got into talking about therapists in group and the differences with working with therapists, and how they, the kinds of challenges that creates when people are, not used to being the patient so much as the analyst.
Yeah, sometimes you have to say, look, let me be the therapist. I'll do the best I can, so you can relax, and you don't have to take that role. There are ways to to challenge people, but it's often, it often is, it's something you have to work actively with.
By the way, it's often,
yeah, go ahead.
Often it's, it's not just because people are therapists that they speak in that way.
Mm-hmm.
They often have a familial history that primed them.
Right.
That's my take, at least.
One of the things that I've been saying to people in the last few years is, particularly when I teach, is don't buy into narratives, whether it's from a therapist or any other person. Don't, always, and particularly when people, people who have been traumatized, you have to be willing to help them deconstruct their narratives, and not just be a witness or listen, although that can be very important. I mean, there's timing and again, clinical judgment, but you really want to help people understand that, it's the same old narrative. And what happens, when you challenge that narrative? And often people get angry at first. Um, it's narratives can be about the past, can be about the present, about a marital situation, a boss, etc. So I'm sure many of you would do this. I tend to be kind of blunt and even rude about it and impatient. Doesn't seem to chase people away. Sometimes they tell me to, relax.
Doesn't it go back to this idea of, why do the work if you don't want to learn something new?
Yeah.
Yeah. You want to have something new happen in every session.
Right. I guess you have so many people that you're learning about yourself from and doing group work as the leader, right? I mean, so I guess speaking of timing, even though it's a little bit delayed to be saying, speaking of timing, that was about a couple of minutes ago. I wonder if it would be a good time to turn it over to participants a lot of people are interested in learning about groups, and maybe they'll have a chance to learn something about themselves through just being able to ask questions at this point.
Right now we don't have too many questions. Marion Margalis has a comment. Do you want to unmute yourself and ask it, Marion?
Sure. Hi, Rich and Tzachi and everybody. It just struck me, but it seems like your point, Rich, that that it makes sense to make ourselves vulnerable and be open to the process, not knowing to take risks. And it's hard enough to be with a patient alone. You talked about pain, and yeah, we go through a lot of painful moments. I certainly go through many times when I question, was my timing right? Could I have waited more? All kinds of things. And then I have to endure that and be okay with it and say, well, there'll be next time. And so it's even harder when you have a whole bunch of people together. You have so much more uncertainty, and it's so spontaneous, but that's also the richness of it. And as much as group is hard for me to do, and some groups I worry about more than others going into it, it's just, that's where the power is, and making ourselves, vulnerable. We can model for our patients. And I agree with you. I mean, I think the individual and the group together is so powerful, and yet so few therapists do it. So I just wondered, I'd be curious to know, I guess, to talk about that. What is it that
Is that for today, or is that for another day where
another day? I just it's
I don't. I mean, I'm open
on my mind.
Doesn't matter. But people want to talk about that. That's fine. I did want to go back to one comment you made, which Marion, about I could have done better and all that, and the risk. And a big source of our problems is the relationship to our superego.
Mm-hmm. It's a big voice. That's a big voice.
Big voice. Dion said the superego is not over; it's sort of under everything, and it's very hard to get away from. As a matter of fact, again, this is too long for today, but there's a line from the death instinct to the theories around superego. If you don't want to, and the idea, and this also is a challenge to relational, in that there's an hypothesis that the superego starts before object relations. That is something we bring to object relations, we bring to early experience, and then link up to primary figures. Of course, it's very different from Freud, who talked about the superego as the era of the Oedipal complex, right? So, I mean, now we're talking about something that we bring from birth. And if we think about it, if we want a parsimonious hypothesis around this, we could think about the very young child who's the center of the universe, so that anything that goes wrong, it's somehow related to the child. So, I mean, you don't have to have a death instinct theory here, an aggressive instinct, but I think it's compelling to think about a predilection for turning blame in on yourself. And actually, if you read Winnicott, of all people, he really talks about how the baby attacks the parent, and the breast, and it has to be allowed so that the baby doesn't feel bad about herself or himself. Kind of detoxifying the aggressive drive. But we don't do a great job of detoxification. And if we, either we're so guilt-laden ourselves, or we do a lot of projection. We find enemies outside ourselves. So, and then as therapists, we do that. Either we can, we're so constrained by our professional affiliations and the superego power that authorities bring to our training. So, it's a again, that's for that we could spend a lot of time talking about that, but I think it was in Marion's comments.
Yeah.
Anybody else have any other questions or comments that you'd like to ask?
I didn't write it in the chat, but can I ask it now? Hi, first I just want to say that this is such a wonderful book, and for me it has also served as a reminder and as a type of recovery that if I'm going into a session feeling that I need to just be empathetic and a listening board and be a space, I know I can always go back to this book to bring me back to like what my real job is and what my real role is with patients. But at the beginning of the talk, you were mentioning how, like in every encounter, something needs to happen. And I was wondering if it can be as minimal as even like an impasse, like you talk about in the book, in the chapter of impasse and opportunity. Like, can that encounter be as minimal or as big as something going wrong? And does that count?
Do you want it to count?
Yes, I do, actually.
It counts. Getting back to the superego, memory and desire. One patient put it much better than that. She said to me, look, nothing has to happen in a session. I'm not in any rush to get cured. Why do you need this? What do you need this for your ego? And I thought it was such a great question. I mean, if I needed it for my ego, it's because my superego was pinching me.
Yeah.
So, so nothing has to happen. But, this really, something always does happen. So you don't have to worry about it so much. As she said to me. Someone's going to come up with something. We're active minds. There's going to be something that emerges, and maybe it won't even be in the hour. Maybe it'll be in a dream that one of you has.
But this idea that Aisha is talking about something needing to happen, I feel like groups particularly, you can leave a group feeling high and so magical sometimes and what's amazing. And then other times you can leave there thinking you're absolutely the worst therapist in the world. I mean, there's such extreme emotions that it can stir up, and wondering, where the balance is and what narrative I have going on in my own head around that, I guess.
Yeah. Bion, who loved to be dramatic, as I said, he tells a story, of doing great work with a patient for around 7 years. And then he said, and then the patient committed suicide. And I realized that we accomplished nothing. So,
Way to bring us down.
well, yeah, but he said it for a reason, and we're not always the best judge. And again, do we have to judge?
Right. Would that mean necessarily that nothing happened also, or that they didn't do any, that he didn't do anything productive, right? Would it have to mean that he didn't accomplish anything? I think.
No, but I wouldn't say it's
Not the most successful treatment.
Right.
I wouldn't like to have a string of successes like that.
Yeah. Right.
So what I heard is that I can stick with the idea that an impasse counts and then completely forget about
Just don't have your patient
committing
commit
suicide.
Anything else goes.
Thank you.
I don't know if we have enough time for this, but or if this, is a whole other event in itself. But I was curious about how things have changed since you started doing groups remotely, I'm guessing through the pandemic, and how different that is to do versus in person there.
Yeah, well, there are other group therapists here. They could answer for themselves. I was struck by how little changes. Same thing with individual. People, particularly, people say, "Gee, I really miss coming in. I want to see you. How important? It's terrible." So particularly now, I said, "Well, come in." Yeah, but it's a car drive. I have to get up early. I want to get to work, and people don't come in a lot when they don't have to.
Right.
So I don't find, I find that almost from the start, groups were as powerful online as in person.
You don't get the opportunity to have people fight over chairs, but other.
Well, yeah, there are a couple of metaphors that I use that are effective about this gets to narratives and empathy. I always say, not always, but I've said many times, get out of that person's square, or rectangle. Stay in your own. Yeah, speak from you. I think people fight for attention at times, and other times people are afraid to take attention, and both come up. And there are plenty of cues in a Zoom session, visual and bodily, vocal cues. I think it's hard on your eyes.
Mhm.
I think a couple of things. One, if we go back to this all about me idea. Initially, Rich, you were talking about that members always have one eye on the leader. I think that on Zoom groups, they actually do look at the leaders all the time. At least that's what I do. And So I think that happens, and it's actually, you don't have in an in-person group. I think you have to hide it a little more, that you're looking at the group leader. That's one thing. And then the other difference is, well, because people are in their homes, all sorts of things have come up, from noises from the streets to kids in the background, to kids. I've had many group members whose young kids, accidentally come in, and it's actually been pretty wonderful, because the other group members often really like getting to see those little kids, and people like to show themselves as parents. Those are some of the things that I've seen different.
Well, I'll never forget the time I was still using the couch, and there was a woman lying down, and the door opens to my office, and our 4-year-old boy, a 3-year-old boy, came in, put his naked butt right by the patient, and said to me, "Daddy, I wiped myself." So we survived that one without any problems. Congratulated him, and he went out and didn't seem to traumatize anyone. So I think these things happen. Trees fall. Worse things have happened. Many of us, all of us, who were working at the time, experienced 9/11 with our patients, whether we did groups or individual. We've been through a lot of traumas together. So there are a lot of impingements. Again, I don't think there's necessarily anything so different about the Zoom modality. People are writing about it. There's been a fair amount of work, and some books now are coming out on that. Maybe if anyone wants to talk to their own experience, it'd be interesting. All of us are doing work on Zoom.
We're on Zoom right now, I think. Yeah. Sometimes you can forget, actually, for me, I find myself feeling like I know people, forgetting that I've only seen them through a screen.
Mm-hmm.
Comes to feel like I've known them in person.
Yeah.
Danielle Canafo, you had a comment earlier. Do you want to share it with the group?
I was just responding to the Beyond story that Rich mentioned, that Beyond said after his patient committed suicide that nothing happened. I think that's, if on the other hand, you're saying something happens in every session, so obviously something happened, and maybe we don't know, or we can't know what happened there, but something happened.
Yeah, but what do you think? I mean, isn't that a reflection of missing what needed to happen in some way? Or, I mean,
It might be, it might not be. Maybe some it does make you think that something was missed or something was missing, but there are people, it could be that, it could be so many things, I guess. Whether the person was really open, authentic about what they were going through, so that Beyond could deal with it. I mean, Beyond was very open about things he missed, even with his own children.
yeah. Yeah.
Yeah. So he might have missed something that was happening. And then concluded that nothing happened. Hard for me to hear that nothing happened. Just like it's hard for you to think that there's a session that nothing happens,
Well, I think it came back to what we're talking about earlier, when what we think we're doing and what we're really doing.
Mm.
I think that was the core idea here. And I think he was admitting that there's so much, there's a big difference between the two.
Often, yeah, not always, but often.
No,
Yeah.
I think always.
You think?
Yeah, because it's our point of view, and then there's the other person's point of view, and then there's our point of view that changes.
Yeah.
So, I mean, it's the old idea, can you ever walk through a stream? There's always something new, something missed, something lost, something gained, hopefully.
William, do you want to share what you wrote in the comment? William Rung?
Yeah.
I was just reflecting that maybe the positive outcome of the treatment was, I said preventing, but that might be an overstatement, but delaying or allowing the patient to experience more of life before something that may have happened earlier could have been a positive outcome of the treatment.
No one wants to be depressed.
I can be
Not
depressed.
today. I was thinking maybe tomorrow.
Any other questions or comments for our speakers or authors?
Yeah. Hi, Rich.
Hi, David. Good to see you.
Good to see you, Rich.
It's nice to see so many people that I haven't seen in such a long time. It's really nice. Sad, too.
Even though some of us have aged quite a bit, huh? Yeah. Anyway, Rich, as part of what you're saying and going along with what you're saying, I always try to get new people into the group, which as I've aged, it's been more and more difficult to do. Now, what I'm considering at this point as this discussion goes on is, a lot of long-term groups have the same people in it in our private practice for years and years. Are we just trying to justify that there's always more work these people can do, and it becomes, at least for me, it's become more and more difficult to get new people into the group? And I used to see that as it would bring life into the group, or things that I hadn't thought of, or in some ways that the group's narrative was fooling themselves into having norms and stuff like that. I'm just wondering if other people experience it the same way, about new people or about having long-term people with the same people in it.
Well, that goes, yeah, for groups. It can go for individual practices, too.
Correct, yes.
What does it say when someone stays with you for many, many years? It could mean that you're a very good therapist or you're a very bad therapist.
True. That question always is there.
Yeah. One woman said, I know every time I try to leave, you're going to say my mother. And then I get all upset and stay for another year. So, yeah, it's, the issue is always, how do you stay fresh? And and you have to have the courage to say, do we want to do this anymore?
Well, I'll give another alternative, Rich. You can always take things like this. This definitely dialogue starts to get you to challenge certain things that it's very difficult to challenge on your own, at least for me.
Yeah, well, that has to do with therapist self-care. And
I think one of the nice things about long-term members is that they can become very sophisticated um, therapists, call it. I mean, or whatever. They bring in very interesting ideas, and I think when I experience that from members, it's very rewarding to have that happen. And then David, the other piece about getting new people in, I think it's really usually about whether, how I feel about the person and whether or not I feel like I feel confident that they're going to like and enjoy and get something out of the group. And if I feel good enough about that and about the relationship, then it's easier to bring it up and to get them to come.
see, look, what do people come?
Well,
I'm sorry.
but I just wonder if that's not our need for safety, because we know these people are coming back. And when you're getting new people in, there's definitely an anxiety that I feel about we're going to go to new places that I'm not, that I'll become comfortable on and I'm comfortable with my own anxiety, but the long-term person does make it secure a lot of times for yourself for certain needs that you have.
Yes. Yeah, it's a two-way relationship in the sense that we're getting something from being with other human beings.
And money too.
Right.
And Lisa, you made a comment similarly. You want to share with the group?
Sure. It was it was the other side of what you said, Tzachi. It is bringing new people in. Yes, there's the confidence that there's something for them in the group, but also that one of the things for them is how others will enjoy them. Because my experience is often when I really enjoy working with someone, I want them to come into group. I want them to get more, and I'm enjoying working with them, and a sense that group members will enjoy them. So that it's a disruption, right? It shakes things up, but it feels like a happy, even when there are ugly moments, it still feels like a happy disruption.
Let's just shift topic just a little bit in terms of goals and what therapy is all about, whether it's individual or group. People come into your practice because they have problems, right? And I think what happens in a good therapy is people move away from problems and they deal with growth. And to me, that's the main criterion of work. And I try to, I don't mind telling that to people, whether it's individual or group, or ideally some combination, it's a growth inducing experience, or should be. And some people use, just the way David was saying that he uses a situation like this for personal growth. Often people use therapy for that purpose and they continue to grow in it. And then it comes up with your, in terms of again, your own superego. If you're working with people for a long time and they're saying they're growing, is it a dependency, or is it a kind of situation where people are really utilizing you for growth, and you might be one of the best sources of people's growth. Now, again, if you're going to be that kind of person, you have to be evolving and fresh yourself, so that you're not stuck in old narratives and even the old relationship. But isn't this true with that, with friendships and romantic relationships? You want something to be moving, to be, to grow. It's like sometimes you see people and who you love, but these are historical relationships, and there's not too much energy left in unfortunately, and so that it's not, doesn't have that same enlivening experience that you want.
Do you find that happening in groups, just when like the energy of a group starts to feel it's waning, is there a way that you will try to enliven a group or get them turn the trajectory around if it starts to feel?
Yeah, there's some groups that are like that. They're afraid. The main reason is people are afraid to say what they're really thinking. So there's some kind of collusion where people are not dealing with each other. I had a very unusual experience, and a sad one, where a colleague and a patient of mine was dying, and she really made me promise her to take over her group. And it was a deathbed. I just felt I had to. And it was quite an experience taking over someone else's group. And one of the reasons she wanted to work with me, she knew that she was kind of stuck in some ways with the group. I think she was a very brilliant person, but she knew she needed to grow a lot as a group therapist. And she stayed with the group, her therapy group, literally until she was on her deathbed. But to get her group going, it was, they really weren't talking to each other about how they felt. They were empathizing, which, we talked about earlier. And once we broke through, it was a whole new experience for them.
Did that have to do with her dying, them knowing that she was sick, or not, or did they not know that she was sick?
They knew at the very end, but this was a long-term problem of not, that she, it was hard to get a certain level of liveliness. And she knew and she wanted it, and she was learning how to do that in the group in which she was a member.
It reminds me of the case you were talking about with the woman who everyone was afraid to, I think she was sick, but people were afraid to confront her about anything, or they're really walking on eggshells around her, protecting her, right? So then she was saying.
Yeah, that was a case where a woman was a very distinguished older person, now a lot younger than I am, but at that time she was older and everyone treated her that way. And no one really talked to her as a person. One of the ways they had to talk to her was saying, get off your perch as a distinguished older lady and join us on our level, which she finally did. But yeah, sometimes you have to break through and get people to talk to each other.
Rich, what you're saying is that's when it becomes from a supportive group to a therapeutic group. A lot of groups are really just supportive and that are empathetic and empathizing, and they're not growth groups. I think I've learned that from you, by the way, of pushing that on. You're always challenging everything, like you are similar to today.
Yeah, but there's an eye in there because it ends up feeling very supportive. Because of what you said, people then feel like something's happening that makes them feel alive. And
also that you're involved with them.
Yeah.
When you're challenging, you're involved with someone.
Yeah. Yeah. Yeah, people, a lot of people say, I like to look at you because I know how often you get irritated. So,
Marion has a comment in the comment box. Marion, you want to share with everybody?
I mean, it just seems like so, it doesn't have to really be stated, but I just, I wonder about that. It's so hard for us as human beings to make changes once we get wed to our narratives, our scripts, our ideologies. But it gets, like, as one patient uses this term so much, it feels so old. And it's exciting. I mean, that's what I find exciting about groups, that it's like, it's spontaneous. Things that you don't expect can happen, but it's also a little bit unnerving that you don't know what can happen. And so it's like, it's balancing those two things.
well, I think there's more to, yeah, that certainly a group can be enlivening, and it is, and I mean, an individual out can be too, of course. But I think, at least for me, you have to have other sources. I think you have to keep reading and listening to colleagues and being exposed to new ideas. I mean, for me, one of the thrilling few idea, getting older is being exposed to the French schools, both in France and in Canada. It just understanding, some of the thinkers. It just is so enlivening to have some new ideas and get out of the the whatever is going on in our own country, for instance, being exposed and to some of the Latin thinkers. You bring it to the work. It gets you out of your narrative that you're talking about, Marion.
For me, it was, I take chess lessons from an international master, and who's half my age, but I think
Hasn't graduated high school yet, is that it?
but I think I get a lot of new ideas. Like, one of the things he said to me, look, I saw your games, and when you play blitz at the end, you're not really playing chess. You're just moving the pieces. I want you to stop, to play slower games, and really think about a plan at every stage. And yeah, that really applies to be able to think in an hour of, is there a plan? Are we trying to do some coherence? Or are we just bouncing, from one direction to the next? Yeah.
Well, I know we're going to stop in a second, but that gets us to the idea of not necessarily having a plan, but realizing that ours have there are moments of cohesiveness, that ideas come together. It's we don't have time today to talk about nuclear ideas, but that there's some central core that often develops in an hour, and you don't have to strain to find it. This is where I'd say I differ with a plan. But it's I mean, Bion talks about too. He called it a selected fact. We're out of the disorganization or the unknowingness of an hour. Something striking occurs that gives a new cohesion and a new perspective on the work. It's a wonderful concept.
Thank you, everybody, for coming today. Thank you, Dustin. Thank you, Rich. Thank you, Tzachi. It was a great presentation.
Thank you.
Really wonderful.